Guess I'll do this. Is this on? Hey, good morning, folks. I think a few folks are still coming in, but we'll get started. I'm Dan Baker of the University of Vermont. Nice to see everybody. Really happy to have such a broad group, a broad range of interests here this morning. And I think everybody knows there's coffee, Danish, and fruit in the back. Please help yourself. I'm a coffee drinker, so I asked we have coffee all morning and actually coffee all afternoon. So not that you should drink that much coffee. Just a thought here, the range of interests and the range of kind of perspectives in the room today, that's one of the main goals. Because one of the things that we're hoping that we accomplish today is to see kind of the range of experiences. And for folks who speak primary language is Spanish, could put the headsets on, and we have interpreters here who will be interpreting into English. The other thing kind of related to that is that when you speak, in order for it to be interpreted into Spanish, you need to have a microphone. And so we'll have a microphone moving around today if you have a question, but I'll come back to that in a second. So I think what we're hoping for, kind of in terms of our sort of aims and goals, is to come out this morning with a perspective, kind of a whole systems perspective on well-being for farm workers, and then farm workers kind of within this larger context of our farm and food system, because it is a whole system, and those pieces relate to each other. And farm workers' well-being, farmers' well-being, community well-being, kind of all play together. So in the morning, we're going to have three presentations on kind of what could at first glance appear to be kind of three different areas: occupational safety, farm safety, access to mental health services for Spanish-speaking and Jamaican migrant farm workers, and then farm worker housing. And hopefully the connections are going to be clear, but just to kind of give you an example, someone you could say, well, how does housing relate to farm safety? And you think, well, somebody who is not sleeping well because the house is noisy, or they're feeling crowded, or they're stressed. They get to work the next day, they're tired, and that raises the risk of an injury on the farm, which can lead to additional stress and kind of some anxiety, kind of a mental health issue. If a person can't speak English and can't communicate well with their employer about, say, for example, a housing issue, that can certainly exacerbate, worsen that housing issue. So I think, as I was talking to Naomi, welcome McCausland right here, our co-host. When we were having this conversation, Naomi's comment was, we could just keep going on about all the connections, because I think when you start thinking about them, there are so many. And of course, we could even broaden this out. Oftentimes, though, we don't talk about those connections. We don't think about a whole system. So we hope to kind of start that dialogue. As well, kind of within that is that aim of bringing together groups that aren't speaking to each other, people who have a lot of expertise, perspectives, sometimes emotions, and think about how we can actually have kind of more gatherings where we speak across these different views. We hope that some of the findings, particularly in the mornings, we're going to have a morning session with three presentations. We'll have a half-hour break for lunch so everybody can walk around, eat lunch, but also, I know folks like to check our messages, a little time to check the messages. And then this morning session is being recorded and will be available online. The afternoon session will only be audio recorded and won't be distributed and won't be broadcast. We're only audio recording to help our own notes. But this afternoon session is only for folks who are here this morning. So we welcome folks that are online. Ernie Bova over there is kind of moderating the online portion, as well as taking questions from you. So at the end of each presentation, you've got index cards and pens on your table. If you want to write a question or a comment, Ernie will gather them, and then we can read them so that it's translated and respond to those questions. You're free to raise your hand and speak on a microphone, but that's how you'd have to do it so that everything is interpreted. Other just kind of orientation stuff. The bathrooms are down the hall. Women's bathroom straight down the hall. Men's bathroom is to the left. I do some emergency planning, so I just like to remind everybody, exits in the back door and exits out over here. I think we talked about microphones, index cards. I just want to talk a little bit about the kind of approach to the research you'll be hearing this morning. We take an action research approach. So the idea is to kind of learn something and use the, ideally identify issues. And then in the best cases, those questions kind of lead us to the next step or some type of solution or something to pursue. So for example, as you'll see, the housing program came out of some research that we did, identifying and kind of understanding the extent of the housing issue so that we can design a program to that, for that. So ultimately, data leads to learning, but data is not perfect. It can always be improved. And so we take a learning process. Sometimes the results are very clear. Sometimes we want to ask the question again to clarify it, or sometimes we want to ask the question to understand changes over time. And I think you'll be seeing all of that today. Before we get started, we have a lot of folks who are on the team here. It didn't happen with any one or two people. Anna Meyerhoff and Betty Getty are trainers here. Anna's also a superstar interviewer. Ernie Bove, a regional coordinator and interviewer. Esbe Hamilton, I don't know if Esbe's back in the room yet. From Vermont Migrant, Alex Chahoan in the back. Regional coordinator and interviewer. Isabel Enriquez Sanchez Enriquez is not here this morning, but we really appreciate all her help. Monica Pineda is here. She was a regional coordinator and is now a community health outreach worker. Charlie Glassberg, been doing site visits for housing. Travis Phillips, who has been working on kind of gathering all the data. And Anna Cortez will be here later, who's also on the research team. So with that, let me just ask if there are any questions. I guess I would, if there are, I'd hand you the mic. And if not, I think I'll get going on my presentation. If I'm doing anything wrong. So I like this photo up here for several reasons, but particularly I've worked in Honduras for more than 20 years now. And the gentleman in the orange hat was up here kind of visiting me. He's a partner. He runs a sustainable agriculture school in Seguatepeque in Honduras, and was president at that time of a whole network of sustainable agriculture schools in Honduras. So he was up here visiting me on a tourist visa. We had a great time. The gentleman that's standing next to him, working kind of long hours, doing a critical job, milking cows, has a very, very different situation. And so he's here most likely without documentation to work. And one of the main reasons there is that there is not a legal visa program for dairy workers as there is for fruit and vegetable workers. And just the contrast between kind of, what's on their mind and in particularly the stress related to migration is really quite different between those two. I also want to thank the Dairy Business Innovation Center, who's funded this research and also funding today's roundtable, as well as the irony that we couldn't actually get one single roundtable in this room. We have all these little roundtables. It was exactly the opposite of what we were hoping for, but the room size did not allow the big roundtable we had hoped for. So I just want to make this point, I'm going to pull from different research, tried to winnow it down this morning, but I've been doing this particular type of work since 2007, when we first started to become aware here in Vermont of both our need for Spanish-speaking migrant farm workers, as well as the supply and folks who were wanting to provide that work. And so one of the first things we did is do an occupational Spanish for dairy farm workers. And then kind of between that time and now, I've been doing these alternate interviews with farmers and farm workers kind of throughout Vermont to understand and track kind of the evolution of of their experience. And then we've also done some polls. Just want to make a little note. All the research that we do is reviewed by the Institutional Review Board here at UVM, which has primary responsibility for reviewing the ethics of the research and how you're conducting the research, and it also kind of looks at our methods and ensures that they are sound. The interviewers for these works are a combination of native Spanish speakers or bilingual professionals. For example, I attend interviews, but I rarely interview myself. And usually when I'm there, I just take up time because I always have a million questions. So I think we're all aware of this, but just to kind of reinforce it, in our last interview with farmers, last large-scale interview with farmers, we asked again about the availability of labor. And what we saw, the blue is kind of the availability of U.S. domestic labor, and then the orange is the availability of Latino farm workers. And so what you see there is that over time, the availability of U.S. workers has continued to be in short supply, and the availability of Spanish speakers and Latino workers has been, there's been sometimes surplus and sometimes just enough need. We've also seen more farms that we interview hiring Latino workers. In 2010, about 56% of the farms that we surveyed hired Latino or Latinx workers, and in 2018, 94%. And so I still sometimes talk to farmers about their concerns, are very real concerns about having a largely a workforce that it does not have a legal visa program. And what I say these days is that really, if you're in dairy farming, if you are hiring off-farm labor these days, you're most likely hiring Latino workers to support your farm. Usually the first question folks ask is how many migrant farm workers, migrant dairy farm workers do we have in Vermont? And there is no census of those workers. So the answer to everything is always like an about. So based on VMEP is the Vermont Migrant Education Program. It's been a core partner throughout this research. So right now, the best estimates is that there's about 800 year-round migrant Spanish-speaking farm workers in Vermont, and that fluctuates. And about another 150 family members that live with them, and that also fluctuates. We have, and Naomi will talk about this more coming up, we have also seen recently increase in families, and particularly families with children arriving in Vermont. We were talking about cross-cutting kind of issues. One of those places that we see this becoming a real challenge actually is in housing, because before maybe you had 4 or 5 men living together, and now one of those men now has a family who's with them, and we have men and women living together, and sometimes children. So that's kind of added a challenge. The other thing I mentioned the public kind of opinion survey. Vermont is really strongly in support of those workers. we've asked this question in a variety of ways over the years. This kind of shows data from 2010 to 2021. I've got one more bar graph that's from 2023, not in here. The trend has continued. You see very, very strong support for these workers. We asked the question about whether the Vermont respondents to the Vermont poll think that migrant dairy workers take away jobs from Vermonters, and consistently they do not think that there's any competition. So that experience of kind of farmers not being able to find local workers and the community's perception in Vermont that these migrant workers are actually taking jobs that need to be filled and that Vermonters are not filling, that is confirmed. And I think there's a lot of implications for having this type of strong public support. It's a sympathetic state in this sense, and that's important because we're also a state that lives up against the border in Canada. And we have found statistically significant increases in stress amongst farm workers who are working in the northern part of the state compared to farm workers who are, say, for example, in Addison County or farther south. So having a population that recognizes the need and value of migrant farm workers is, I think, interesting and important to note. So I talked before about kind of asking questions more than once. There's a tool called the Migrant Farm Worker Stress Inventory that's been used around the United States to look at stress issues for migrant farm workers. In nearly all of those cases, it has been applied to fruit and vegetable workers who have access to HTOA program, although there's many that are here without documentation status. But we took that migrant farm worker stress inventory and applied it to dairy. We made a couple of modifications. So we took the inventory itself and we included that kind of in the survey in 2016 and 2018, 2019, the two times we did it. And we want to use that same inventory so we can compare across states. And on that metric, we found that workers here in Vermont are relatively stressed. They have a high level of stress. We also wanted to add to that inventory questions that we thought were important, either to dairy or because of concerns that we have in the state. And one of those questions that we added was specifically, I'm concerned about being injured working on a dairy farm. And in both of those surveys, we found concern about injury on a dairy farm was in the top 10. And that's why that's in blue. But a couple of things to note about this. In two different surveys, we basically came up with the same top 10. The ordinal ranking was even similar with one difference. So consistently, kind of top concerns are issues related to migration. So kind of the journey here, concerns about being deported as really areas of very high stress. And then we also have a cluster of kind of findings that relate to social isolation and distance from family. And so that's both the experience of being separated from family and having family back in, living back in their home country, as well as being on a rural farm, oftentimes without a lot of other Spanish speakers outside of your farm, and not just and not being able to communicate. Things that weren't in here, so long hours were in here, and I'll get to that in a second. There are other issues that were not within the top 10, but that are still significant to a certain portion of the population. So housing is one of those things. Housing does not come up as one of the highest stressors overall, but for, I think in 2016, 11% of respondents were extremely stressed by housing. And that is actually, we'll get to this later, it was useful because it defines the problem and becomes something that we can plan for and hopefully address. other issues here just for our folks, and I apologize that this is not in Spanish. We will be translating this in Spanish and making this available to everyone after today. But other things just to note is weather does matter. It is difficult to work in bad weather, and of course, not being able to communicate well in English. I wanted to add this because this was, this comes up a lot. It was one of our top 10, and it's an interesting question. Is how many hours are you working? How many hours would you like to work? And what are and how many hours do you want before you go find a farm that can give you more hours? The mean is we might think of as the average, and that includes, from the lowest to the highest. The median is where you've got half above and half below. And the reason we like to look at both of those is that when you have some extreme, it can kind of pull the mean one direction or another. And so, here for the average number of hours, this is from the current survey, so 2022 to 2024. We have a median of the average number of hours that folks are working are 70 hours. And, the median number of hours they're working are 70 hours. The ideal would be 60 hours. And if they, on a median, half above and half below, if they don't get 60 hours, they're going to be looking for another farm to work on. And then in terms of kind of stress, I just want to kind of give you a little bit of that background on the stress. Again, this is from this current survey, asking the question again, just to understand how things are changing. We do find about 8% of workers find long hours extremely stressful, and about 14% moderately stressful, and about 44% not at all stressful. The project that we're here today, and I want to say, Catherine Donovan and Katie Spring from DBIC, Laura Ginsburg couldn't make it today. We want to thank them for kind of funding this project. I want to thank Agrimark Cabot for its support, and the Northeast Center for both helping us with providing trainers and interviewers. Kind of part of the grants was to kind of engage with farm workers around occupational safety and well-being. To date, we've kind of engaged with about 233 workers through 196 interviews, and we are going for the round number of 200. I think we're actually up to 198 right now, as well as we did 3 stakeholder meetings in Spanish with Naomi, combining the occupational safety and access to mental health projects. Then we're also doing on-farm trainings in safety. And one of the objectives of the interviews is to help us refine the training programs. And I'll kind of finish the presentation today talking a little bit about what we've learned there. So 196 interviews, 96 farm workers and interviews on 56 farms in Vermont. And we've done 100 interviews on 32 farms in New York. Just a little bit about kind of the demographics of the workers that we interviewed. About 77% are from Mexico, and 23% from Guatemala. We have not seen a lot of other Central Americans up to this point, although that's always something that we're kind of wondering when that may happen. Here in Vermont, we found this consistently. We have a very large number of folks up from Chiapas, in kind of the southernmost part of Mexico. Veracruz and Puebla and Tabasco kind of always jockey for a second, third, and fourth place. For folks from Guatemala, about 12% from Huehuetenango. In New York, in our interviews in New York, we found a much higher number of folks there from Guatemala. About 22%, over 1/5 of the interviews that we did in New York were Guatemalans. all that's important where folks are coming from, and because we may think that if you're coming from Mexico or Central America, that your first language is Spanish. And that's not always the case. So Spanish is the primary language for 96% of Mexicans, but about 4% speak an indigenous language, and Spanish is their second language. And about 20% of Guatemalans, Spanish is their primary language, and 20% speak an indigenous language, of which Quiche is the most common. Other kind of things, I'll go through these fairly quickly. I just want to make sure that clock is.
Dan, actually, this might be a good time for a pause for a changeover for interpreters,
Please.
so they can take a break.
All right,
Yeah.
good. And I just want to make. That's what Ernie's job is. He's supposed to keep, usually just me on track. Naomi's like, and Julie are going to be. All right. We good? All right, thank you. So kind of right now in our set of interviews, we got about 85% men and 15% female, almost 16% female. One thing that we have observed kind of over the years is, initially it was almost all men that were up here working on dairy farms. We see an increasing number of women. Naomi can speak to that. But it does kind of change, like we said, housing. It also changes issues with access to healthcare, among kind of many other issues. Obviously, or not obviously, importantly, sexual harassment becomes more of an issue. We have a bigger issue. The migrant workers tend to skew a little bit younger, although we're actually seeing this age increasing. So in this current survey, we have about median age of 28 for men and 29 for women. And I was surprised about that because formerly we've been seeing a much younger age for women. Men have been here longer. So kind of an average. And I wanted to use the average here because on some farms and for some individuals, they've been here 15 or 20 years. I mean, they've really kind of built their life here, kind of established themselves. So the mean is about almost 6 years for men. Average time they've been here in the United States, and quite a bit less for women, 3.7, just under 4. Of that time that they've been in the US, both men and women have spent most of the time working in agriculture. And just to kind of reinforce the point, migrant workers from Mexico and Central America are important for dairy. They're also absolutely fundamental to our entire US food system. Dairy, to some extent, came in after our dependence on in other fruits and vegetables. Most of these workers do not speak English. We're seeing some improvement over time, but you can see the majority here, or just under half, report they speak very, very little English. I didn't include a slide here, but I'll just make note that when we interview farmers, they speak very, very little Spanish. And I'm always interested in how people actually manage to work that out on rural farms in Vermont, where the farmer doesn't speak Spanish, the worker doesn't speak English. How are they actually doing it? And one of the ways that consistently in surveys, they say they use hand signals. And over time, and particularly in recent years, we see more people using handheld translators. And the number of professional translators has increased. So a lot of feed companies, kind of nutritionists, vets will now speak Spanish, as well as the migrant education program, Milker Dignity and Migrant Justice, and groups like Addison Allies come in and support them. 61% of workers said that they did feel that their English language ability affected their sense of safety on the farm. And of those, about 15% said they felt there was a significant safety issue. And as I look at that, I wonder sometimes with that challenge in language, whether it's easy for a Spanish-speaking farm worker to know what they're missing, like to know that that label on that bottle is something that's important, and that were they to kick it over or get it in their eyes, would cause an injury. So I think that's probably an underestimate, but that is what we received in this email. Over time, we've seen a broadening of job responsibilities for migrant farm workers. So back when we started these surveys, it was really like, what's your primary job? I'm a milker. And now, particularly for men, we're seeing men on farms do many more jobs. And I think it's interesting. So about 58% said their primary job was milkers. So we asked two questions. We asked your primary job, and then we also asked questions about what else you do. So this is just primary job. So they're down from like over 90%, 10, 15 years ago, to about just under 60% are milkers now as their primary job. A lot of care for calves and young stock, feeding cows, cleaning barns, about 12% doing other jobs. Feeding cows, cleaning barns often involves the use of skid steers. And we're starting to see more workers on skid steers, which is a particular hazard. And I think we may see in coming years kind of this trend increase as people are on the farm for longer, 5, 6, 7 years. The farmer wants them to do more jobs, and they're interested in learning those new jobs. So we'll probably see folks on more equipment. For women right now, it's a little bit closer to kind of where it was initially. About 80% are milkers, and about 13% care for calves and young stock. And we'll just point out, and we'll come back to this a bit, most of these jobs mean that you're working in very close contact with very large animals. A lot of the kind of risk in dairy kind of comes from that kind of close contact with large dairy cows. We always ask this question about kind of folks' ability to move to places and farms where they were more comfortable. So in this most recent survey in Vermont, we found that a little bit over half of the folks that are on farms now, this is their first farm. And so they haven't worked any other place, which was a little bit surprising, but kind of important to note. So their perspective is really just that one farm. For the remainder, for folks who have moved, or not for the remainder in that sample, about less under 23%, more than a fifth, have moved to a farm that is less stressful for them. I think that, again, things that have changed since I started doing this work is mobility has increased. So we do have the driver's privilege card. And that allows farm workers to move, both to socialize and to socialize, buy food, and also to kind of move to different farms. And then with cell phones, there's much more communication and ability to find a farm that kind of is better suited for you. And about 17% is about the same, and about 5% they move to a farm that's more stressful. And we might expect or even hope that they move to the farm that's better suited for them. We also ask about how Vermont's doing relative to the rest of the United States. And of the 40 farm workers we interviewed in this most recent survey, about 48%, almost half, find Vermont more stressful. And again, thinking about living in a state where so many people kind of value the farm workers that are here, it is, I think, interesting to note that this is a stressful state. We don't have very many Spanish-speaking kind of people in the general population. We are challenged with Spanish-speaking professionals, and we're right up against the Canadian border. We're increasing, I think the estimate is something like 2/3 of Vermont is within the jurisdiction of Border Patrol. And that's a federal agency, and Vermont's sway over federal agencies is obviously limited. I want to get into kind of some of the injury data that we found, and I just wanted to put this into context. Farming, and particularly dairy, it is one of the most hazardous industries in the United States. I just wanted to just quote here from the National Institute for Occupational Safety and Health. That was an interesting quote. Agriculture in general ranks among the most hazardous industries. Farmers themselves are at high risk for fatal and non-fatal injuries, and farming is one of the few industries in which family members who often share their work and live on the premises are also at risk for fatal and non-fatal injuries. Recently, we did our first pilot of a sort of hands-on equipment training, and we were talking to the farmer in preparation for that meeting. One of the things he said is he said, Dan, I want you to start off the meeting just making sure that the folks who work on this farm, migrant workers, understand that we're not just concerned about kind of their ability to be safe on the farm. We're concerned about kind of everyone's safety. And so this particular farm has a culture of safety that is rooted actually in a grandfather's being injured in, I think it was a corn chopper, where much of the skin of his arm was ripped off. He had to have skin taken off his belly, grafted on his arm, and he never really fully recovered. He died young. And so that farm, and this is multiple generations, whenever this comes up when I'm visiting that farm, they mention that injury because it has really formed sort of the worldview, the farm culture on that farm. The other thing, just around that same time, we had a farmer that Kelsey and I was a goat dairy farmer on a project we were working on recently, who turned over his skid steer and was killed. And that farm was out of business by that weekend. And so it is really something that is kind of deeply rooted in agriculture, and really one of the perennial challenges in agriculture and dairy, which we're talking about today, is how we create safe, healthy spaces. And I could keep going. Two dairy farmers I know, when we were talking about this, we're talking about being slammed in the head with a gate. One organic dairy farmer was telling me that she was hit in the head with a gate almost a year ago. And I just ran into her in the Middlebury Co-op the other day, and we were talking, and she still has vision problems and memory problems for it. So it is really a serious issue. It's a challenge. In general, we have very poor data on farm injuries. Fatalities get reported, but injuries oftentimes don't get reported. The Northeast Center right now over in New York is actually trying to look at different ways to track farm injuries because we don't collect them. And so looking at emergency response runs, for example, and seeing, or hospital registrations. So we don't have great data, but we wanted to try to see if we could, what we could learn about what was going on with farm workers. And, you know, when we asked the question, have you been previously injured on a farm, over 50% have been previously injured. And we're still in process of kind of sorting out the severity of that injury, but about half were previously injured, and about a third still suffer from that injury. And many farm workers have been injured more than once. And, you know, sometimes it's, I pinched my finger in a gate and it required just a little first aid kit on the farm. And sometimes it's I had my hand crushed, my arm crushed, you know, 2 years ago, and I'm still suffering nerve damage from that. So it is a really broad range. About 40% missed work due to that injury. And in Vermont, for the 19 workers who missed more than 3 days of work, about just under 60%, about 58% were paid for that. And this is kind of one of those issues where which side of this data do you want to look at? You've got about 60% of farmers paying for folks who are injured went during their injury, and you've got about 40% who did not, according to this data. in comparison, in New York, which is has much larger farms and many more farms who are under OSHA regulations, they have 11 or more workers. About 16 farmers who were out for more than 3 days. About 80% were paid for that time. This as a comparison. Oh, and this is important. About 20% of the folks that the farmer paid for injuries in about 65% of the time. And we found almost 20% of workers, and particularly in and around Addison County, who went to Open Door Clinic and received kind of free healthcare from Open Door Clinic, which really has expertise in working with Spanish-speaking farm workers in the Spanish-speaking community. Of the injuries, we had about, again, this is preliminary data. We're just wrapping this up. We looked at 67 reported injuries. The vast majority of them, not surprising, were directly from cows, being kicked or pushed or pinched. And then I'm only laughing because 3 injuries from gates. I was talking to that same farm worker who got hit by a gate, and she said to me, getting hit by a gate, that's basically being injured by a cow. Because what moved that gate, that cow kicking that gate, and that's what hit you in the head. Slips, chemical injuries, so kind of foot baths, limes, cleaners, lifting or falling, 1 reported accident from needles, and then 14 other accidents. What happened there? About what happened there was a typo. About 59% of farm workers said that they received some training when they began working on their farm, compared to 70% in New York, or 75% in New York. But the folks in New York, again, the farms in New York are larger, and so they do have that OSHA regulation, and we don't have that in Vermont. Of the Vermont farm workers who had received training, and I think this is really important, about 54% were trained by a coworker, about 19% by the farmer, and about 12% by a professional. That's really low numbers of trainings by professionals. One of my icebreakers when I go on farms, whenever I see somebody driving a skid steer, I'll say, "Hey, who taught you how to drive that skid steer?" And he'll be like, this other farm worker. And it's sort of like sometimes you wonder if it's a game of telephone, where at what point did somebody actually get real detailed professional training on the skid steer, and how long ago was that, and who's checking on that training. So I think there's some opportunities there for us really to improve that situation. And that's what we're trying to do kind of in this grant. When we asked folks if they would be interested in more safety training, about over 90%, 91% said they would be interested in additional farm safety training. Farmers and farm workers tend to prioritize the training needs differently, although kind of over the survey, things have sort of fluctuated. Kind of one of the sort of a catch-all area of training is milk parlor safety. And so that could include a lot of things, but about 60% noted that was kind of extremely important training for them to receive. For skid steer, we looked at just those folks who operate a skid steer kind of on the job, and about 56% of those 45 said that they prioritize that as a kind of a great need. Chemical safety, very high, about 55%. PPE. When we initially started the survey, we had an other category. And the other category, we had not asked about fire. And what was surprising, a lot of times you get scattered opinions on what would be in the other category. Early in the survey, we started to find a lot of folks responding they wanted actually fire prevention training. And so we actually added that in as a kind of maybe a month or 2 into the survey. We added that as an option. About 50%, more 52% said they wanted fire safety training. We also heard several stories really about farm workers kind of saving the farm, saving the barn, saving the tractor by being the one that was there, They knew how to operate a fire extinguisher and put that fire out, potentially saving hundreds of thousands of dollars for that farmer. So very important. And then we actually get down to animal handling, down cow, and needle safety, which is oftentimes for farmers, they're usually wanting us to start with animal handling, large animal handling, and equipment. So a little bit different in terms of the ranking. We also found migrant farm workers interested in a much broader range of subjects than kind of in traditional or conventional training programs. So we asked, for example, about zoonotic diseases, diseases that can be transmitted between animals and humans. About 75% had never received any information about zoonotic diseases. And about 53% said they were very interested in learning more, and about 43% somewhat interested. So really kind of some evidence that that particular maybe non-conventional training is something that workers would like to receive. They perceive that as being something that is both interesting and very much could affect their health. I do just kind of note that little graphic is from the kind of One Health initiative of the Centers for Disease Control. Zoonotic disease transmission, as well as antimicrobial resistance, which is also a question we asked about, would also had interest. Both of those are kind of part of this global effort to address kind of these farm safety and food safety concerns. We talked earlier about stress, and we asked folks both how they manage stress and whether they'd be interested in personal training on stress. And one of the things that I think we've kind of noticed over the last few years is folks able to kind of get out a little bit more, particularly here in Vermont with the driver's privilege card, go hiking, go fishing. Farmers have taught them how to ski, taught them how to fish, brought them to fishing places, bicycling, as well as talking to family and friends on the phone, connecting by internet, watching music, playing movies. But there's a very strong interest in learning how they themselves can kind of manage their own stress. And I remember just recently, Isabel and I were talking with a farm worker, and this particular individual was just very confident. Nothing bothered him, he wasn't stressed at all about anything. And we asked two questions that were interesting. One was about how well he slept. And he was like, I'm only sleeping like 4 hours a night, even though he has 8 or 9 hours available. He just isn't sleeping well. And then we said, would you be interested in personal training and stress management? And he was like, yeah, definitely. So it was just kind of, it was interesting. He presents as a very confident person, but he's really kind of holding a lot of that stress inside. And we're going to come back to that and transition to Naomi's slides and talk more about mental health. Just very quickly, we are now in process of doing farm trainings. We've done 8 trainings completed in Vermont, 7 in New York. In Vermont, we're, in addition to kind of the conventional trainings, we're looking at some alternative equipment training. So Liz Kenton from UVM Extension was on a farm here doing a really interesting farm safety, equipment safety training, kind of using toys and balance points to kind of demonstrate risks of flipping. And then Anna's been piloting some stress reduction trainings over in New York. And we're interested in really kind of exploring more about how to do that. I really try not to finish any presentation without just promoting and just recommending that we all read The Most Costly Journey. It was a really extremely innovative project. Teresa Mayers was involved with that, along with the Open Door Clinic. That has, I think if you haven't read it, you'll find it eye-opening about kind of both the journey here and folks' experiences kind of when they are, when they've arrived. So with that, I'm going to stop. I know we're running a little bit late. We're good? Naomi says we're good. So if you've got questions or comments, you just take a moment, please write them down on the index cards, and maybe, I see Sarah back there. I always like to tap Sarah. If she just wants to move around the room, maybe pick up cards, give folks a minute, and then we can do it. While we're sitting here, I'll mention another story. I got lots of farm safety stories. I was talking to a farmer a couple months ago, no, about a year ago. I think I was with Ernie, and we were talking about this project in farm safety, and this farmer was like, one of the things that really just concerns me is the bunk, the feed bunk. And this is a picture of a feed bunk if you haven't seen it. It's particularly dangerous when you're packing the bunk. You got to drive your tractor up a kind of a steep mountain of feed, and it takes a lot of skill to do that. What was interesting to me was that this farmer was talking about the face. So if you've driven past a farm in Vermont, and you've seen the feed bunk and it's kind of cut, looks like a very solid wall. I always thought it was a solid wall. And to the point where you just stand there and next to that solid wall, feeling pretty secure. What this farmer was saying is that actually what has happened and can be really fatal quite quickly is that apparently stable wall of feed can just collapse. And so if you're a person on a farm and you don't drive a skid steer, you're not packing a feed bunk, you think you don't have any risk to feed bunks, but you're not aware, as I wasn't, of that risk, then you could be standing in what you thought was a very safe place next to this big solid looking mound of feed and have that wall collapse and injure or even kill you. So with that, maybe Sarah, maybe you want to just pass whatever cards you got up to Ernie and we can start on that. And then yes. And for any Spanish speakers that are here, if you want to take a microphone, you could ask the question or write it in Spanish, either one. You may hand this to Ernie.
Fire away.
Far away.
Okay, all right. First question or comment. Dan, you mentioned the percentage of workers whose employers paid their medical bills after work-related injuries. What about the percentage for whom the employer filed a claim with workers' comp? Why was that not reported?
We did ask workers about whether or not workman's comp was filed. So we do have that percentage. I don't know that off the top of my head, but I could get that and report that later. It was not as large as the number that paid by farmers.
Maybe just give the interpreter just a brief pause to translate. Yeah, you mentioned changing demographics, more women in the labor force. Does your group have a sense of the children, the next generation, in school or not? Projections on growth.
We do. And Naomi's going to talk about it. And I think it's really important for us to kind of look at that data and the rate of change.
Do you perceive farmers and farm workers to be aware of existing resources, for example, bilingual trainings on farm safety?
To varying degrees. We've been promoting the farm worker housing program for the last couple of years that Julie will be talking about. Think that we're doing all the outreach that we can do, and we still find farmers either who haven't heard about the program or more often misunderstand what's possible within that program. So I think we could do a better job of getting that out, and to some extent today's kind of one of those efforts of sort of sharing information more widely.
A couple of questions here. First, what does housing generally look like for farm workers? And second, would you say 80% of women are milkers, partly because on average, they've been in the US/agriculture less time?
A couple of things. One thing, we're actually during the housing presentation, we'll talk about kind of what we've learned from these surveys on perceptions of housing and how that's changed. So I'll wait on that. Early on when we started seeing an increasing number of women on farms. One of the comments from farmers was that they found from their perception, was that women were particularly good with working with animals, and they had a certain sensitivity. The other, I think the bigger piece is that if you're a dairy farm, you need to milk cows. And that is kind of one of the entry jobs on a farm that has to happen. And so I think a lot of it is that women are newer to dairy farm work, have a little bit less experience, and so that's kind of their entry. I would expect, if I was looking to the future, that we're going to see more women feeding calves and young stock, and possibly doing some kind of nutrition. Yeah.
Next question. Are the farm trainings being recorded for future use?
We have the farm trainings right now we have PowerPoints. So we can use that again. I think that one of the biggest things that we've done over the course of this project is expanded the number of trainers that we had in Vermont. So formerly we had 1 trainer in Vermont, and we now have 3 through this program. And we don't have to ask Anna Meyerhoff to come over from New York as frequently. But we'd like to have more, we would very much like to have more trainers. And we'd also like, it just reminded me, I mentioned piloting the equipment training, hands-on equipment training. Right now in Vermont, we do not have a Spanish-speaking hands-on farm equipment trainer. And Liz Kenton from UVM Extension is working with 4-H, and so we borrowed her from 4-H to do our adult trainings. Anytime I talk with Liz, she says, we have so many resources. We would love to increase the number of trainers in Vermont. They have a program for farm workers where you can become certified, kind of showing the levels of skills you've got on equipment and equipment training. So the opportunities, the resources are there. What we really need is more folks who are bilingual and interested in doing that type of work.
Okay, question on Zoom here. Do you have any data about injury rates comparing migrant and non-migrant farm workers? And if there is a sense that the language barrier may lead to more injuries of a specific type versus others?
It's an excellent question. The answer is we don't right now. There really is not a good system in place right now for tracking non-fatal injuries. There is a national system that is what's used in many industries, but farms in the Northeast are kind of fall under those thresholds, and so that they don't fall under that regulation.
How do we budget?
If I can just add that, we always want to know more about what's going on with U.S. citizen workers. It's actually a very challenging population to interview. We've interviewed them a couple of times, but they have busy lives and a lot going on, and oftentimes they don't live, about 40% don't live on the farm. Mm-hmm.
How do we bridge the gap between farm worker and farmer priorities when it comes to safety training?
That's a greate question. And to some extent, that's what we're trying to do here. I think that what we're doing right now is really a first step in a longer process of trying to understand kind of the farmers' concerns and interest in trainings and their perspectives and what farm workers are interested in. And one of the key things is communication and dialogue. And we have this kind of fundamental structural issue of two different languages. So I think, thinking about how we communicate, one of the things that we hope to do this afternoon is to kind of talk about how we can facilitate that conversation so that folks are comfortable. And I think on both farm workers have concerns sometimes about raising safety issues with farmers, as well as language challenges. And farmers have challenges kind of speaking to the workers and understanding kind of what it is that's on their workers' minds. I could go on about that a lot.
With increased migration to the state from other countries and other industries, is there concern about this impacting employment in dairy overall?
Yeah, just repeat that one more time.
Yeah, so with increased migration to the state from other countries, and other industries, is there concern about this impacting employment in dairy?
Yeah, and I think there's other folks, Naomi or Sarah Stolma can talk a little about this. We do see the movement between dairy and farming and say other industries like construction or restaurants, which is also short of workers. Large sugar makers now also demand workers. So there is some pull in that sense out of dairy towards those industries, and that fluctuates based on demand in those industries. And in a sense, in the case of kind of what's happening in terms of migration, I think the increased number of families and children is sort of one indicator of that change in migration patterns affecting us here. I think the answer is yes.
Can you connect training with the National Farm Worker Jobs Program and with Pathstone resources that can add to your work?
Yeah, a lot of programs have limitations for workers that are here without documentation. That has been a challenge for some dairy farm workers.
Who should bilingual farm workers who might be interested in becoming safety trainers get in contact with to do so?
Come talk to us. We would love to talk to you.
Okay.
Yeah, and I say that not to be short, like Liz, we would connect you with Liz, who has a training program. It's like I said, and so she would be the resources, but yeah, we would love to hear, love to hear from you.
Has adaptive equipment for workers who experience disabling injuries or other disabilities been explored at all? Are there ways to offer that?
Oh, that's a great question. That is a great question. I can say that I have not personally heard of someone being retrofitted with an adaptive device, to my knowledge, and my knowledge is limited. So, I know for many dairy farmers who were injured, that's been actually essential for them to continue. So that's another great question. Thank you for that.
About four more comments. I don't know if we've...
2 minutes. Is it 2 minutes or two people? Oh,
Okay.
both probably. We said two individuals you know of.
2 minutes left. Okay. We just got 4 comments here, questions. Do OSHA regulations specifically include all farm workers, meaning documented and non? What labor laws in Vermont also apply / can be regulated for undocumented farm workers?
So as far as I'm aware, OSHA kicks in at 11 workers. And I don't think your documentation status matters.
Have you explored work on contemplative practices to support farm worker and families' mental health?
As a stress reduction technique, I'm assuming.
Thanks. Yeah.
We have not in that phrasing, but we are open to learning contemplative practices, like meditation, I guess.
I believe so, yeah.
Yeah, breathing. Yeah, I think that's the type of what we're looking for. Those things, particularly you don't need a lot of equipment, you don't necessarily need a lot of space, and you can do that. Thank you very much for those questions. Just for folks online, for anyone, daniel.baker@uvm.edu. If you are interested in becoming a trainer, you should please let me know, let Naomi know, and we will love to talk to you more about it. Thanks very much. I'm going to look up the workers' comp later at lunch and can get back to folks on that. 5-minute break? Okay, 5-minute break. And then Naomi will be up here to resume. Thanks very much. Okay. 5-minute break. Yeah, bathrooms, women's bathroom straight down, men's bathroom down to the left.
All right, so it sounds like maybe we're at like, I don't know, 60% compliance. Can folks Sarah Stowell, Kelly Dolan. I know a lot of you out there. Come sit down, please. Okay, so pause is after the question or just in between everything, like,
A little bit.
Yep.
Question and then before everything.
perfect.
We'll have 30 minutes.
Okay, great. Did you have to, I feel like I have to bend down. Ugh. Can folks just raise their hand if they can hear okay? I feel like I need to be leaning towards the mic. I will start off by saying this is not my preferred method of communicating. I'd much rather be sitting down at a table or at, in a U shape or something like that. But I will deal with standing up in front of you all. I'm Naomi Wolcott-McCausland, and I'm going to really just be focused on a mental health assessment that Dan and I did, commissioned by the Agency of Ag with Farm First, to look at farm worker mental health, migrant farm worker mental health, including, what services already exist, what does utilization of services look like, what needs continue to exist. So to start, I just wanted to tell you a bit about migrant health programs, the area of work that I lead. I work with UVM Extension. My programs really look at how to build health equity within migrant and immigrant communities across the state. Initially, the focus was Spanish-speaking farm workers, and more recently, we've expanded to include non-agricultural workers. For better or worse, as you'll see in one of the slides, there have been a lot of changes to migration patterns in Vermont that were not anticipated. The flagship program or the kind of main foundational work that we've done has been around the coordination of healthcare services for individuals that we serve through promotoras or community health workers. Monica is our representative today. I don't know where she is, but she's out there. She is right in the middle of the room. I wanted to start by clarifying that when we talk about this migrant health, mental health assessment, we are talking about, yes, dairy workers, which Dan talked a lot about in his safety presentation, but also seasonal workers. And about 88% of seasonal workers in Vermont are from Jamaica. They speak English and oftentimes patois. And you can see by the slides that even though most year-round workers are on dairy farms, they also work in other ag industries, and most seasonal workers, the bulk of them are on orchards, but the individuals who are here for 8 to 10 months tend to be in ground crops. When we decided to do the assessment, we really wanted to look at the related research that existed, so including a lot of data that Dan has already shared. But being someone who is more focused on programming and having seen over the years the different types of programs and initiatives that were connected to mental health and well-being, it felt important to include program reports and data connected to this topic to get a better picture of what was really going on within this community and how services were utilized and what the gaps were. There was a lot of personal communication with farm workers serving organizations. The benefit of kind of being in this work means that through a text message or an email or WhatsApp voice memo, we can get information pretty quickly, which I had to do yesterday to get a sense of like what's going on with all these new kids coming to the farms. Thank you to the Migrant Ed program. Something that I think is important to recognize that we did, I think that was really informative, was to have stakeholder meetings. So we put together an assessment based on what we knew, and then we invited service providers together, 21 different organizations, 33 people. This was in December of 2022. So the assessment kind of was over the course of a little over a year. And the individuals there provided feedback on the draft assessment. We talked about a few different models and initiatives that were currently happening. And then through small group discussions, got feedback about where to prioritize time and efforts looking at mental health and well-being within the farm worker community. And then we held 4 meetings with migrant farm workers. 3 are the meetings that Dan mentioned that were a combo of looking at safety research and getting feedback and mental health, which, as you hopefully learned from Dan, there's a lot of interconnectedness between stress levels and farm safety. We had one small group of workers from Jamaica, and we talked about, what the stress survey results were. Did it seem like it was in line with the participants' experiences, and what they currently are doing to reduce stress when they are feeling stressed? We talked about strategies for supporting coworkers and friends, and then got suggestions and feedback about programming to prioritize across the mental health continuum. When we first started talking about doing this assessment, I was struggling with how to represent the fact that there are so many interconnected pieces when we talk about mental health and well-being, and that even though oftentimes we say mental health and people think crisis, counseling, there are so many other elements that are connected to how someone stays well, and what they need to kind of live their best and fullest life. And so we decided to think about this work as kind of sitting in these different areas. So, what programming is connected to helping people thrive? What program is kind of helping people just get by day to day? What is available or what is needed if someone's struggling? And then what does that look like when someone's in crisis? So we did send out the assessment ahead of time. I made an assumption that probably not a lot of people had a lot of time to read it. If you did read the executive summary, I apologize. This will be a pretty big repeat of what was on there, but it felt important to really be on the same page about what we're talking about, and hopefully in the afternoon be able to spend some more time talking about what the findings were and what the recommendations were. Yeah, so I think the big thing, and again, this is really, even though there was research that backs this up from the stakeholder meetings, and from program reports and from some on-the-ground work that different outreach programs do, it was really obvious that workplace conditions impact farm worker stress, and that's compounded by the social and structural determinants that exist from their experiences back home. What are the push factors? Why are they coming here? And then what are their experiences while they're here in Vermont? And that those same stress factors limit farm workers' ability to maintain positive mental health and well-being. So we wanted to recognize kind of the context from their country of origin, the geographic, linguistic, and cultural isolation, particularly for farms that are in rural Vermont, and as Dan noted, northern Vermont. The border proximity and less access to transportation makes a really huge difference. And we saw that in our stakeholder groups, and we've seen that in the data, both with Jamaican workers and dairy workers. The fear of not being able to economically, financially support loved ones back home, and more increasingly on the dairy side, family members who are here, impacts stress levels, and then how they navigate communication about that stress and what's causing that stress. Connected, I would say, to compensation and why someone might not report a work injury for fear of losing their job. And then working and living conditions can be a factor in terms of stress levels. For Jamaican farm workers, it is, I think, an area where there has not been a lot of programming. There has not been a lot of research, even though they have been in the state. Many workers have been here 20 or more years, coming back year after year. But for the most part, there hasn't been a lot of targeted programming. And then there's less research on what their health and well-being needs are. I think because they're here on H-2A visas, there's kind of this assumption that they don't have barriers to health and well-being services. And we found that that is not the case. Transportation is an issue, cost is an issue, awareness of services. And then interestingly, the work schedules are even more in conflict than on dairy farms often to accessing health clinics when health clinics are open because they're working all daylight hours. And then on the service provider side, there's a limited knowledge about how to best serve this population. We also found that when there are well-being activities available, when there are mental health counseling services, it's utilized, but those things are dependent on grants. It's always time limited. There's been a handful of grant-funded initiatives over the years, and there are tools that exist, but there's not the capacity to support people to engage in those, to either continue the work or support people in finding and utilizing tools that exist, oftentimes targeting or tailored towards farm workers. And so when you have these programs and you build relationships around offering a particular service that 7 months later you can no longer offer because there's no funding, that impacts the relationship that you have with the workers and their likelihood to reach out to you if you are trying to do another project that's potentially still connected to health and well-being, but might not be what you were doing previously, which was of use to them. The general population, well, I'll start by saying it's hard to access mental health services for everyone in Vermont, right? A lot of the challenges to serving farm workers within the agencies that are often the agencies that would respond to mental health needs, those are not unique to migrant farm workers. At the same time, it's important to acknowledge that at this point, our assessment is that safety net clinics, for the most part, and designated mental health agencies, even though they can be free and low cost, even though there is a desire to serve everyone in their community, and even though they offer mental health services, are not currently well positioned to meet the transportation needs, to meet the language needs, to engage in the type of outreach that is necessary for a mobile population. When you do your yearly physical, you're probably asked a few questions about your levels of stress. Oftentimes, that is a key way for providers to identify whether or not someone might need a referral, either due to depression or anxiety or even food security. We found that even though those types of screenings have identified some individuals who might be in need of mental health counseling, and those connections in some cases have been made, it's more common for farm workers to get support from a trusted community member who suggests that perhaps counseling might be of use to them, and then the referral is made through those trusted conversations versus via a screening tool. And that again underscores the importance of ongoing outreach by people who have established relationships with the community so that there's that trust and making sure confidentiality is in play. When there is counseling services that are in Spanish that address the transportation needs and are free, farm workers and their family members do engage. So this chart really looks at two different initiatives, one through the Open Door Clinic. Unfortunately, they just have one nurse right now, and so she was not able to come. But they had a grant together with UVM Extension. They were able to hire a bilingual counselor, while through UVM Extension, we paid for 2 hours of a bilingual clinician's time. And so we saw when that became an option, we saw the increase in numbers of patients utilizing mental health services significantly increase. as well as the number of visits per patient. And when that funding source went away, that number went back down. There is a significant need for mental health counseling for children and youth. There was a question that Dan got about numbers of children on farms and youth on farms. The two slides here, the first one is looking at the growth over time of individuals that we serve through our program, Bridges to Health. The yellow is non-agricultural workers. And so you can see there is an increase in non-ag workers over the past 2 years. And then the green, which is harder to see on this slide, but it has more than doubled, is the dark green, is the number of children on farms. And many of those children who are enrolled, both receiving support through Migrant Health and through Migrant Education Program, came, I wasn't sure how to explain it, through precarious routes, so most likely across the border and not on an airplane. There are also about 36 out-of-school youth, so individuals between the age of 14 and 17 who are on the farm. They are not enrolled in school, and they are working up to 72 hours a week. And again, thanks to Migrant Ed data, this might be low, actually, because some folks haven't been fully COE'd yet, Sarah, but 38 children and youth. So individuals under the age of 18 have arrived in Vermont since January. We're in the beginning of March, so 2 months, 38 kids. That's a huge number. That's more than what we were seeing over the first 10 years of the work that we were doing. And that's not replacing. It's not because people left. It's in addition to who was already on the farms. Many of these children are isolated from their peers, Spanish-speaking peers. They've often experienced separation from their family members, sometimes one or both parents, and many have been held in detention facilities. There's a health insurance plan that is awesome, that covers individuals who are not otherwise eligible for Medicaid or Dr. Dinosaur because of immigration status. It does not cover services provided by designated agencies, which is where most children would be referred if they had a mental health need. And many schools use designated agency counselors to provide services. So that means that those children enrolled in that plan cannot receive covered services through those counselors, which is a significant problem, in my opinion. And then we haven't found any Spanish-speaking clinicians who have been able to successfully work with children either within Migrant Ed and or within migrant health programs. So there's a lack of access to bilingual providers who can serve children and who can serve adults. Our last finding, and then I'll skip to recommendations, is that there is a lot of interest. So Dan's study showed that there was interest in engaging in mental health promotion activities off-farm as well as on-farm. Focus group participants in our first of the 3 with dairy workers, there was a suggestion of an off-farm kind of wellness day. And so we brought that up in the next 2. And there was a lot of interest in both the opportunities to learn about different strategies to reduce stress, but then also the opportunity to socialize off farms. And then there was also interest in by farm workers in becoming trained to better be able to support their family and friends and community members, yet a strong lack of interest in something like peer counseling, feeling like chisme, the gossip and the confidentiality would create problems for that to be a successful model. So in terms of our recommendations, we really were trying to be comprehensive in making some suggestions of different ways that some of the workplace and push-pull factor stress indicators could be addressed. So immigration reform is something that would significantly impact how people can move and be in Vermont. There's also interest in having more standard across the farm workplace standards with the buy-in of farm workers and farmers and advocates and service providers. Workers' compensation came up. There is a lack of oversight in terms of workers' compensation, fear related to reporting because of the unknown of potentially losing your job. And so that's another recommendation, making sure that farm safety trainings are promoted, that there is access to personal protective equipment, supporting workhouse improvements, and then access to workplace English classes, something that Migrant is doing, but yet again is a grant-funded program that requires ongoing funding. We also recommend that farm worker health outreach programs have stabilized funding. So for organizations like the Open Door Clinic, Little Rivers, and UVM Extension who are doing the on-the-ground health outreach, it's predominantly grant funded. Right now, staff is at capacity in terms of addressing mainly physical health needs and funding for the community health workers that work in areas where farm workers are, the NEK, Franklin County, and Addison County for the most part. That funding ends in June. And so if we want to address mental health, you have to address physical health and look at the whole person. And you can't just carve out the mental health piece and say, here, let's just focus on that. But sorry, your back hurts, or sorry that, you have this rash. There needs to be tailored outreach to Jamaican workers. It's a distinct population with distinct needs. And then there can be training for farm workers, for outreach staff. There is interest in that. So there needs to be standardized training to support individuals who are interfacing with the farm worker community to better be able to respond to mental health needs and doing more on-farm education. Because of the feedback from the farm worker stakeholder meetings, we would recommend organizing regional health promotion events. We want to really respond to what we're hearing from farm workers about what their interests are, but then also responding to the survey data that Dan has, where people are interested in either on-farm or online trainings around stress reduction techniques. Another thing that came up was just not having an easy place for external partners to really find, what programs are doing what and who can be referred where and what does that referral process look like? Can that live somewhere? And can somebody maintain that? It should be that we would recommend that exists. And then creating kind of evergreen type of professional development opportunities for schools, for farm owners, for service providers who maybe don't work with a population a lot, but have interest in learning more about how to better serve the population. And then going back to kind of the mental health continuum and the in crisis piece, there is a lack of access to bilingual, bicultural mental health providers. And then all these other barriers, right? The transportation barrier, the cost barrier, the work schedule barrier. And so our recommendation is to fund a telemental health model that would allow people to, from their homes or a safe place in the community or potentially within schools for our children to connect to clinicians who understand the migrant experience and that create low barriers to access. A lot of times, if anyone's accessed mental health services, there's a mountain of paperwork, you have to do a lot of screening, and then maybe in 6 months you might get an appointment. And we've found that at that point, there's kind of this window of opportunity that if someone has a need, if you can respond to that need, they're more likely to engage. But if it's 6 months down the road, their stress has probably moved on to some other area. And so this again is just kind of a continuation of that. If people are doing virtual visits, making sure they have headsets and what they need to have as much privacy as possible. And then really looking at how to best meet the child's need. If there are children with needs and they don't have transportation, can that happen in the school environment where they're already there, but they can have a safe place. And then the final recommendation is really just looking at what are the policies that could increase access to services. So one would be ensuring that across state lines, mental health clinicians can provide services. So we may not have a lot of bilingual, bicultural service providers. How can we access those that exist in other states? And then the final one is just that can the Vermont Immigrant Health Insurance Plan change so that children can receive services from designated agency counselors? So that is the, and I can't go to my next slide apparently. Oh, there we go. So I don't know if anyone has any questions. We can do the same thing as before. Either write it down. I mean, it's a small enough room, so if anybody wants to yell out a question, I'm totally fine with that as well.
Yeah.
Oh, sorry, you do have to talk into a mic, so the interpreters. If someone feels more inclined. And I can repeat, I'm happy to repeat the question too, if Sarah's not speeding around the room.
I'm just wondering, because I was really interested when we were talking about IHIP, right? And you're looking at policy changes. Can you tell me a little bit about kind of where you're at with those discussions? I know how I know the whole room doesn't know this, but I understand how the designated agencies are funded. So I get why that might be a holdup, being that it's primarily Medicaid, right? But I'm wondering kind of where you're at with that.
So we as UVM Extension can't promote a specific policy change. So this is a recommendation based on the assessment that we did. However, my understanding is that IHIP, the way that it was written, excluded community-based services. And by excluding community-based services, so it's a Dr. Dinosaur lookalike, but not quite exactly the same. And so when you exclude community-based services, that includes designated agencies, and it includes things like lactation support at home through home health providers. And so it was something about how the law was written. And so somebody needs to look at that.
Okay.
You were mentioning about transportation being an issue and the communication and language barrier. If classes were available virtually for English classes, just depending because of transportation, them not being able to leave the farm depending on work hours and it being late. If English classes were available virtually, is internet access a huge problem or barrier in dairy farms?
So I'm going to pause to let the interpreters interpret.
Thank you.
Because I was told I need to. So we have found, and I would say the Migrant Education Program has found, that for the most part, individuals have smartphones and they are connected to the internet and have been able to participate in online English classes that Migrant has been offering for many years. Possibly there needs to be, more English classes. But again, that's linked to grant funding.
I have a question on youth mental health, given the bullying that takes place in school these days, and given the language and the cultural barriers that many of the children of migrant laborers go through. How big a problem is it, and what's being done to address it?
Like a 10-second. I'm trying to see if the Spanish speakers are done listening, so I should start to respond to your question. So I would say Migrant Ed is probably more well-positioned to answer that question. We definitely have heard from family members, but we've also heard from students that they're fearful about even bringing up issues of feeling like someone has spoken to them in a way that makes them feel unsafe because they already feel uncomfortable in those environments. One thing I did mention was just the lack of peer support. So when we look, if we had a map of each school and grade level across rural Vermont, it's changing. But there's many of the students that are served that only are the only person in their school, or the only person, at least in their grade. And so I'm hoping that over time, by talking more about some of those challenges and being inclusive around conversations of bullying, that will be addressed. But to my knowledge, unless SBA or someone from Migrant wants to say anything differently, I don't know that there are any specific initiatives, looking at, language barrier and kind of bullying among this population.
If you could just give a brief pause for interpretation before there's a response.
Responding to that.
Or- Okay.
No. Okay.
Naomi, I'm curious if you have, from the research, suggestions around how the sustainable funding could be addressed. Is it that we need, multi-year federal funding appropriations, or joining of resources that already exist in the state, or something else?
Vermont is unique in that we've never had a huge number of migrant farm workers in any one location. And so we're one of few states that don't have a migrant health center, which traditionally in other states would look at physical health and mental health, and oftentimes have a community health worker program as at the core of what they do, specifically reaching out to farm workers, but then also other populations that share similar barriers. So there's, because of the disbursement of workers, at this time, we are not aware of any federal funding that would allow for such a health center to exist. And that limits the grants that are really available. So in an ideal world, yes, you would have kind of foundational funding to do outreach that could connect some of these topics that we're talking about today, where there can be continuity of staff, but where that funding comes from is a challenge, because oftentimes grants require you to enhance what you're already doing, reach a larger geographical area, or it's these small pots of money, which is what a lot of, Open Door Clinic is doing. UVM Extension is doing, is just like trying to pull together those resources. But I think if it was a conversation at a state level, it would be thinking about who are the interested parties, who benefits from having healthy workers on our farms, and are there different ways to buy into a model that makes sure that people can access healthcare services as well as any other person in Vermont. So no specific magic way of doing that.
I have a question, I think that's building off of this or related. You mentioned the community health centers, or I think that's what they're called.
Yep, community health centers, or FQHCs. So those are your safety net sliding fee clinics across the state.
And so what I'm trying to understand is there a sense that there's like interest in, like I was hearing that language and transportation, like having farm workers access those existing centers, language and transportation are barriers. But is there a sense that those institutions are aware of the migrant farm worker populations in their catchment area, and that there is interest? Or I'm just trying to understand like what their level of interest in being engaged. I feel like it's a
So I would say that generally, yes, community health centers as well as the free clinics across the state are aware of who's in their service area. When you look at their patient population, though, it is a very small percentage of their total patient population. And when you look at health workforce shortages, you kind of come against you have the desire and interest, and in many cases, knowledge that doesn't match with the capacity to actually meet people where they are. Because it does have to include outreach. You saw that, the 40 almost 40 new kids. They didn't come here on their own. They were with at least one parent. There's a lot of movement that is happening. And so if outreach doesn't exist as part of that, then it's hard to get people into the clinics. In terms of language, we've seen a huge improvement in health centers in offering language services, but unfortunately it often doesn't provide support across all points of contact. So for someone who's at the clinic, they'll connect to oftentimes a video or a phone, but for someone calling in, they will often get hung up on. Or with the billing piece or with the prescription piece. So there's gaps in the language access. So that's an area that could be improved. So it's going back to interest, but funding. You know, our sense is that there has not been a way to build out some of the positions that we think could work well in these settings, because their larger patient population has a lot of other and varied needs.
If you do want to give me a card, if you're more comfortable asking questions, I can still pick those up as well as
How
pass you the
much
mic.
longer do we have for?
So I think we have about 5 more minutes and then
Okay.
we're going
The
on to
interpreters do
housing.
need just a brief pause, a minute or two to change over.
Yeah.
So yeah. If anybody wants to put their questions or comments on note cards while they're doing that.
Are they switching right now?
Yes.
Oh,
Yeah.
¿Nadie más tiene preguntas? Ni Pedro. I think Pedrito's our supporter in the back, has a question. Yeah, ¿quieres un micrófono?
Yeah, we're all set.
Okay, this may be a little bit out of left field. So, when I lived in Tennessee, I personally benefited from the remote area medical program when they brought it in, and, I translated for a friend of mine and saw that it was very well utilized. So, I haven't paid attention to what they've done in the last like 15 years, but I'm curious if there may be some kind of resources and infrastructure that they have available that could be helpful in Vermont, or if that's something that's worth looking into.
Yes, I believe that a clinic that was held in Bennington County, it must have been in the fall, was in collaboration with the Bennington Free Clinic down there. I think the Department of Health, Medical Reserve Corps, and the RAM program, is that? So I think there's potential, but I don't know that it's been explored fully.
Ok.
Or English, it's up
Hola,
to
mi
you.
nombre es Pedro. Pues yo solo quiero agradecer a todos aquí por todos estos programas que cuentan ellos. Y yo acabo de tener un hijo, ahí está.
I just
Entonces,
wanted to thank
todos
everyone for all the programs and all the interest. I just had a baby. He's right over there.
y todos estos programas de que Naomi está hablando, con los pagos, toda la educación, todo esto, yo he estado aquí desde muy joven, desde los 17 años.
And all these programs that have been available, everything that you have mentioned this morning, I've been here since a very young age. I got here at 17 years old. Yes, 17 years old.
Y pues todo el proceso hasta ahora, pues sin la ayuda de todos estos programas, no sé qué habría hecho.
And so far, I mean, without the help and the assistance of all these programs, I honestly don't know what I would have done.
También sobre el tema de la seguridad en los ranchos, yo creo que muchos de nosotros, bueno, tal vez sabemos algunos trabajadores aquí, no sabíamos de estos peligros, no teníamos ni idea.
In regards to the safety in the workplace at the farms, at least speaking for myself and some of the workers here, we honestly were not aware of all the risks involved in this type of work.
Y pues yo quiero agradecer a todos por estar interesados en nosotros, porque a veces como inmigrantes pues estamos solos.
And I want to thank everyone for being so interested in us, because as migrants, we are alone.
Gracias.
Thank you.
Gracias, Pedro. He was not a plant. No le dije que dijera eso, ¿verdad?
Very bad.
Is there a need for a migrant daycare or a migrant Head Start in Vermont?
Does Migrant Education want to answer that question? And then we probably have to wrap it up.
So I'm Esme from Migrant Education, and the answer is yes, but there is a huge need for, in all of Vermont, for early childhood care, for pre-K. Transportation to pre-K is huge barrier. We have a lot of little kids. A lot of them are not going to PK because they don't have transportation. But like something like a Migrant Head Start would be similar to like the Migrant Health Center. It's in one spot. So that's much more difficult. Like I think you were talking about the different schools, right? I don't remember exactly how many schools we have students in migrant education. It's a lot. There's one that has 4 students. There's one that has 3 students. All the rest of them have either 2, usually from the same family, or 1. And so there's no, like, where would the Migrant Head Start be? And what would be the transportation to get there? How long are those kids going to sit on the bus? Maybe in Enosburg, you know, there would, but I don't know that we have like the population in any one place. So yes, there's a need for it, but like not a mechanism.
Thank you. So I do want to say before we pass it off to housing, that the whole reason that we chunked out the afternoon for discussion is to be able to continue talking about some of these issues. So if you have other comments and questions, we can get to that in the afternoon.
Okay, so so Julie and Charlie, you're gonna come up. And tech folks, where is that PowerPoint? Where is the PowerPoint? This is not a touch screen. Okay, good, because I wasn't gonna touch that screen on the right, because you know what would happen. The whole thing would blow up and I'd be like, I don't know what I did.
That's kind of hidden under here.
All right. Nice.
And it's this top one.
Yeah. Okay, I'm gonna open it up. Okay, you won't just stand right up here. All right, hi folks, I'm gonna just do a little quick introduction to the housing, and I'm gonna turn it over to Julie and Charlie here. So I'm gonna dive right in. Okay, so we're just gonna cover a few things here. A few things, looks like a good list, a little bit on the background and the studies. And then really Julie and Charlie are gonna talk about the repair program, case studies, and the replacement program. So just to kind of orient everybody, when we look at benefits to farm workers, housing is one of the most significant non-wage benefits. And it's particularly important for migrant farm workers, where about 100% of them receive housing and utilities on the farm. You know, it used to be if you were a farm and you didn't have internet or cable access, you didn't have any workers. So housing and utilities compared to, this is from 2018, for US workers, it's a little bit over 60% have housing on farm. So it's quite different. And one of the things that's challenging, and we will talk about this more this afternoon, is with migrant farm workers in the context of a statewide housing shortage, they can't leave the farm and really to find housing, and if they did, there really is no housing available. So it's kind of a cross-cutting issue. When we look at kind of the issue of density, Just a little bit of data there, but we found about 6% of, well, it's actually 10% of farm workers are in a house that doesn't have sufficient space. And so they have to actually share a room with an unrelated person. We were talking earlier about kind of that issue with sleeping and stress and not getting enough sleeping. Even if you have enough hours, if you can't sleep those hours, or if you're being interrupted, that's really a problem. So I didn't put the data up here. Density is not in and of itself sometimes an issue if there's enough kind of bedrooms and space. I mean, folks, there are benefits from living in a house with people that speak the same language and share the same culture, as long as there's places to get privacy, to be able to sleep and have quiet. And so that kind of 10%, that is actually a real concern there, a little bit over 10, almost 11%. This was interesting. So we asked this question twice. So in 2016, we asked about, this is from the wording is from the Migrant Farm Worker Stress Inventory. Sometimes I feel that my housing is inadequate. And in 2016, about 11% of the folks that we surveyed said that it was an extreme stress to them. And, a little bit over about 24% said it was moderately stressful. In the current survey in Vermont, we do see a reduction of that number. Just a couple of things I want to comment on that. We're not doing a panel, so it's not necessarily the same people that we're interviewing. And in these interviewing years, there has actually been several programs that Julie's going to talk about and Charlie's going to talk about to improve housing. Milk with Dignity program has been working to improve housing, as well as farmers recognizing in a tight labor market that housing is essential if you want to actually be competitive, finding workers. So that's kind of a little bit of a metric or an indicator of the need. Just want to point out one last thing, and then I'm going to turn it over to Julie and Charlie. We've been working on this issue for the last few years, and there has not been a place to kind of have a discussion of farm worker housing. And so we started back in 2019. We had this initial discussion online kind of during COVID, bringing in different groups involved in housing to discuss this. Buster is here today, and he has been a major advocate for actually formalizing this group, and we have not found a formal home for this. And so in the absence of a formal home, we continue to meet almost twice a year to discuss housing. Vermont Housing Conservation Board produced a report in 2021 on farm worker housing, and John Ryan recommended a few tasks for the housing group that included kind of coordinating efforts between groups that are working on housing issues, because initially the kind of traditional affordable housing folks and the farm worker housing folks were not speaking. And we continue to see this to be a challenge. And then we have yet to get to an action plan, but we continue to work on educating and engaging the housing agencies. And we definitely want to think creatively. And with that, I'm going to turn it over to Julie.
Thanks. I'd like to say good morning, but I think it's technically afternoon. So good afternoon, everybody. And thanks for being here. As Dan said, I'm Julie Curtin. I'm the Director of Homeownership at Champlain Housing Trust. And I'm joined by my colleague, Charlie Glassberg, who is the real boots on the ground for the housing work that I'm going to talk about today. So Charlie's going to share about some of the specific projects that we've actually done. And I'm also here with Travis Phillips, my colleague, who is our Associate Director of Lending and has done a lot of work to help us grow this program. So I wanted to just take a minute or two, and let's see, I think if I hit that button. All right, great. I'm not a professor, unlike some other people who've been up here. So a little new to the technology. But just a brief overview of who Champlain Housing Trust is. We are based here in Burlington, and our service area is technically Northwest Vermont, so Franklin, Grand Isle, and Chittenden counties. And we really fall into that bucket of a traditional affordable housing organization. We have thousands of rental, low income and affordable rental units. We also have almost 700 permanently affordable for sale homes in our service area. So we do a lot of housing. And we also have a lending line of business predominantly to provide resources to low-income homeowners to make home repairs. So these are folks who live in homes maybe they've inherited from a family member and couldn't afford to live anywhere else. And so we have expertise in making loans and in helping improve housing, doing projects to rehabilitate old housing stock. And I give that background because that provides the context for why I'm standing here talking about a farm worker housing program. In 2021, we were invited to apply to the Vermont Housing Conservation Board to run a new farm worker housing program. We applied in partnership with UVM to do a statewide program to provide loans essentially to farmers who wanted to improve their existing farm worker housing. And so that we're now in year 3, and that's what I'm going to talk a little bit more about today. Just a note about our partnership with UVM, and Dan primarily, but Kelly's here, who helped us start that program, and a number of the regional coordinators as well. That partnership is essential to our ability to do outreach to farm workers and farmers to know that there are resources to improve housing. So Champlain Housing Trust couldn't do this work without that partnership. So what is our program? We offer forgivable loans of up to $30,000 per dwelling unit for farms that want to make repairs to their housing. They're loans because we want the money to be paid back if the housing's no longer used as farm worker housing or it falls into disrepair. But otherwise, there are no payments due, there's no interest charged. And essentially after 10 years, there's no repayment requirement at all. So really it's just a way to make sure that the funds are going to improve farm worker housing for a long period of time. We launched the program in early 2022. We've had 2 rounds of funding. We're now in our 3rd round of funding. And over that period of time, we've learned some things that have allowed us to sort of make some modifications to the program. We have our new funding would allow us to do 40 more projects, and we need to deploy the funds by the end of September 2025. Because a lot of farms have multiple farm worker housing homes, often they're old Vermont farmhouses, as farms have bought farms in the neighborhood, they then also buy an old farmhouse where a couple of farm workers might live on one part of the farm and they might live on another. And so particularly for our dairy farm applicants, we saw even in this short period of time, repeat applicants who wanted to fix up multiple units on the farm. So we now allow up to 2 $30,000 forgivable loans per farm for, you just have to have at least 2 different dwelling units to benefit from those funds. The types of repairs that can be made with our funds are very extensive and are largely based on the Vermont Rental Housing Code, which does apply to farm worker housing. So what Charlie will do if we have an application from a farm for a repair project is after speaking with the applicant and getting a sense of what kind of work do you need done, he'll actually go visit the farm and use a tool that we've developed to assess the condition of the housing. Imagine it's sort of like if you had a home inspector come and look at your home, what are all the things they're going to look at to make sure that this is adequate housing? And on the slide here, you can see some of the types of things that we would work on and fund with one of our loans. Often we are seeing projects that hit multiple areas. So we might have a farm that needs a kitchen renovation and a bathroom renovation, and a new septic system. We also often see farms that need the full $30,000 and then some, which is a little different than what we expected. Based on that John Ryan report, we thought we would get applications for smaller projects, maybe $3,000 to $5,000 in scope. And I think our experience has been essentially 100% of our applications are for the full 30,000, and most scopes of work are costing more. And so farms are investing some of their own resources to do all of the work. To date, we've received applications from 60 farms across Vermont, and we've approved projects on a wide variety of farm types. While it's not shown here, you can see that there are a lot of different farms that have taken advantage of this program, but the largest percentage are dairy farms, which makes sense because dairy farms have probably the largest percentage of their workers need to be on farm, given the nature of their work. So generally speaking, based on the information we get in our applications, we've served almost 150 farm workers through this program. And we're really striving to serve farms throughout the state of Vermont. Most of the farms that we've served have been in Addison County. Again, that sort of links to most of our applicants have been dairy farms, and there are a lot of dairies in Addison County. Second is Franklin County. And I think to date, the only county we haven't served is Essex County. So we've even expanded into Southern Vermont with our second round of funding. Now we'd like to show you a few of the projects that we have worked on, and these are projects that have been completed. So we're going to show some before and after pictures. The first case study is a dairy and in Addison County, and I'm going to suggest you take the microphone there, Charlie, and just give us a brief overview of the type of work and costs. So I'll go ahead and show the picture.
Yeah, you can. So yeah, this dairy down in Addison County. So at the site visit, walking through, so we take a lot of photos to kind of identify current conditions. At this housing, they had a lot of exterior issues with rot, water damage, lack of insulation, issues with the roof as well. And so that was all put onto that scope of work. And then we can keep moving. So yeah, and then this is it after. So they completely redid the siding, redid the roofing, added insulation, helped with drainage and things like that. And so that really improved both the kind of comfort of the home, being able to heat and cool it more efficiently, but then also, keeping out rodents and things like that as well. So.
And I think you told me this farm had already done a lot of interior work
Yes.
on their own before coming to us to do the exterior work.
Yeah. And so, yeah, we do tend to catch people they've already completed some work, but there's a lot more to be done. So we get to come in and help farms realize that. This second one, also in Addison County, this home was actually, it was a kit that was bought back in the 50s or 60s, if I remember correctly. And the exterior had a lot of work that needed to be done based on just the kind of funky design of the home. Again, water infiltration was an issue. A lot of the windows had leaks associated with them. The roofing needed to be replaced. There was also some issues with it. Hadn't been in use for a number of years. So there was some electrical upgrades that needed to be made, as well as some water line work that needed to be done. And so with that, they added new roofing, siding, upgraded some of the windows, as well as just made some of the interior spaces, including this basement, more of an operable space for the farm workers to use. And then this third one, another dairy up in Lamoille County area. This project was pretty substantial. So we had an original estimate of $30,000. The project ended up coming in well above that. Yeah, so really kind of the whole, almost whole home if you think about it. So a lot of it was exterior. There was asbestos siding that the farm had already kind of started removing. And so re-siding was going to be an issue. Again, water infiltration, drainage, things like that. The entry deck space was near collapse and unsafe. There were children. This is a 2-unit building. There were children who were living here, and so improving the safety there as well was a concern. And so with that, added additional roof, reworked the roof, added new siding, reworked that exterior deck and entry space to make it a little bit more efficient and less issues with rain and things like that. And then on the interior, there were a number of fixes, including both, inoperable windows, single pane, block cracks, things like that. And then in the bathroom and kitchen space, just, cabinets and things like that weren't functional. In the bathroom, there wasn't exhaust and the window didn't function properly. And so improving those spaces. So upgrading the cabinetry, replacing windows, improving the overall layout of the bathroom space. I think they also replaced the vanity there as well, so that it could function more properly and efficiently. So, yeah.
Yeah.
I think that was it.
Thank you, Charlie. So quickly, I'd like to also describe our second farm worker housing program, also funded by Vermont Housing Conservation Board with dollars from the Vermont legislature. This is a program to replace existing housing that cannot be repaired. So there are some circumstances where housing is in such bad shape that the farm really needs a new home. So this photograph actually is of one of the replacement projects that has been completed in Franklin County for I believe it's a 5-bedroom home. To be eligible for a farm to be eligible to apply for the replacement program, they need to have existing housing that falls into one of these categories. So it might be a mobile home that's was manufactured in the 1970s and is just at the end of its useful life. We also might see housing in barns or offices. A couple of projects we're working on in that situation. So you just can't rehab the milking parlor to be housing. So farm wants to take the housing out of the barn and put it in a home. We also can address overcrowded housing and other old housing stock that just can't be rehabbed with the repair program. All are eligible projects under the replacement pilot program. A little bit of detail on the loan terms, essentially much bigger loan amounts up to $120,000 because these are much more expensive projects. To give you an idea, the range of cost for a replacement home could be maybe around 200,000 at the bottom end of the range. This is if there's a perfect flat piece of land and there's already an existing septic that has capacity, on to over $500,000 to install a new home. Because we're putting in a foundation, we're putting in septic, we're utilities. There are a lot of costs just to get the site ready for the home. Then the housing that we are using to build these replacement homes is actually pretty cutting edge. It's zero energy homes. So these are highly efficient buildings. They a farmer can choose to either have a stick-built home, so essentially built with a general contractor from the ground up, or buy a modular home where the home is largely built in a factory setting and then shipped in a box and assembled on site. Or with our partners at Efficiency Vermont, we are piloting a highly energy efficient manufactured home that comes on a trailer and gets installed on a pad. The idea being we need all of these options to have a good quality product that is the most cost-effective option for the operator. Because as you can imagine, we're coming with $120,000. If it's a $500,000 project, there's a big difference that the farm needs to cover. And we are working with partners like Milk with Dignity to bring resources to these farms to make them cost-effective and reduce the barriers to access to these resources. We've encountered a number of challenges along the way. It's a new program, so that's to be expected. We've responded sort of as best we can in real time, and we are grateful to have some flexibility. You can see them listed here. We've found that contractors can be hard for farmers to find and keep engaged. So we try to get folks talking to contractors early. We've had questions about who are farm workers that can be eligible to live in the housing. And essentially we're borrowing from the current use program's definition of farm worker housing, which essentially is housing that's provided to farm workers as a non-monetary benefit of their employment. We find that farm owners have limited capacity to fill out an application for the repair program. And they also have, just by limited capacity, I mean time. These are very busy people. And that gets compounded in the replacement program context where you need to manage contractors, bigger, get multiple sources of funding and a lot of permitting. So we've tried to supplement that by hiring a project manager and construction expert to do outreach with farms. And that's been very helpful. We've now had a couple rounds at this, so we're standardizing our procedures to make our own processing time more efficient. We've expanded to allow multiple projects on the same farm. And we're always trying to respond to people's questions about eligibility and how to calculate their income for purposes of being eligible for our program. So when in doubt, please call us if you have a question. There are some challenges that we know are out there and some needs in terms of farm housing that we're not able to meet. I do get calls from farm owners who say, I don't have a habitable place to live on my own farm. What can you do to help? We also know that there are farm operations that need to grow and want to add housing. And right now our program is really focused on replacing existing housing. So how can we serve the need of farms to expand? We've heard a lot today about the changing demographics on farms, which changes the types of housing and the need for housing. And largely we are, the farm says, I need housing for my workers, and we provide a loan. That's about as involved as we get into that. And of course, the high costs and farms, finally, just the uncertainty of, will I be in business in 10 years? And how is this going to impact my exit strategy if I have a 10-year loan in terms of the repair program, or in terms of the replacement program, a loan that's essentially I'm going to have to pay back if I sell the farm. We also, in partnership with UVM, have really worked to connect to the people living in housing so that farm workers know that there are resources available to them if they have ongoing concerns about the quality of their housing. So in addition to outreach with UVM Extension, we also post signs in all of the properties that we've improved that let the people living there know if you have questions about the housing or concerns, they can reach out to us so we can be aware of them. Also, because we are a housing provider and we serve a lot of newcomers to this country through our housing, we have actually over a dozen languages online for people to access videos on how to live in your apartment. So we have all of these sort of tutorials on how to use housing and keep the housing in good working condition in Spanish available through YouTube. And always looking for ways to do outreach. So with that, here's our contact information. We'd love to hear from you about what we can be doing better to serve Vermont farm workers and their housing needs, and what we can be doing better to serve Vermont farms and their needs to provide good quality housing.
Are there any questions before we get into lunch?
We just give about 30 seconds to a minute for changeover for interpreters. Just a brief, yeah. 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 Yeah.
You mentioned for the repair loans that often folks are going above that $30,000. And I'm wondering if some of the current applicants are using other programs, like you mentioned, Efficiency Vermont, or I'm thinking of like the low cost, like lead mitigation, especially for these farmhouses, or maybe other programs that I don't know about.
We are mostly, I think they're using their own resources. We are working with the State Office of Economic Opportunity to try and modify or connect the weatherization program with these projects, because we are finding we're really focused on health and safety. And so sometimes where farmers will cut the scope is in like putting in heat pumps because they want to use sort of the current technology to add those energy efficiency upgrades, but cut that out because it's above the 30,000. So if we can partner, Charlie's done a lot of great work to try and take the weatherization program and match it with this program. I don't think we've ever had anyone use lead mitigation money, have we, Charlie? Not yet. And VHCB actually does administer that program for the state. So that's something I think that's a good reminder that we should reconnect with them. And then I think, yeah, and people, most of the time farmers are tapping into that credit line to draw some more money to do this.
I have a question on, because you mentioned the rental compliance like regulations, or I'm not sure what the exact wording was, but how much is like at will by the farm owner versus like they're falling out of compliance with, and like who are they falling out of compliance with, and like is there, so I guess the question really that I'm trying to ask is there a mechanism for targeting the worst of the worst housing versus, you know, banking on farm owner motivation to improve housing? And then just a second clarifying question. I thought that on one of the slides it said that 50% of the loan for the housing was paid at like midway in construction, and the other 50% was paid at the end of construction. But then I thought you said there was a 10-year period. So if you can just clarify what the repayment is.
So to your first question about the rental housing code and enforcement, there is a statewide rental housing code that does describe standards of, just health and safety standards that all rental housing should have. Working smoke detector in every room. I don't want to quote it, but it's those sort of ideas. And to my knowledge, there is not an enforcement mechanism in the state for the rental housing code. It's been a subject of debate in the legislature recently. I think some advocates have proposed legislation to have, sort of rental registries and fees that would fund a system for inspections throughout the state of Vermont. That does not currently exist. I do believe we've done some outreach with town health officers because some towns do have an ability to have a town health officer who could go and inspect housing and make a determination that that housing is out of compliance with the rental housing code, so that, we could get referrals. At the end of the day, because we are a real estate driven program, we are dependent on the owner saying, I'm interested in participating and willing to, in exchange for your funds, put a mortgage on my farm to secure those. So that is just sort of the reality of our program. To your question about the mechanics of the loan terms on the replacement program, when we distribute the funds, so say we make a loan of 120,000 for a new replacement home, we'll distribute 60,000 when it's halfway built and the remaining 60,000 when it's complete. And then we will say, you don't have to pay back the loan, the full 120, until you sell the farm. The first 10 years after the project is complete, up to 30,000 of that $120,000 loan is forgiven. So we've given the replacement borrowers the same benefit as the repair borrowers. It's just capped at $30,000. And I should say, with the replacement projects, we have one that is under construction that has received a grant from the Working Lands Enterprise Board, which was really essential there, and I know was an expansion of their sort of normal scope of funding. And then word gets around, and I think a bunch of more applications have gone in for that sort of grant funding, just demonstrating that farms are really eager for, if there are more resources, they would like to do these projects. And we certainly appreciate that support from the Working Lands Board.
Folks,
Can you hold on just a second? This helps with interpretation.
Should I wait for interpretation?
Kate from Milk with Dignity Standards Council, just wanted to add that in addition to the working lands applications that are going in, we were able to funnel some private funding to some of these farms. And I am continuously approached by donors, past donors, potential donors who want to give more for that. So just to beef up and reiterate what you're saying, that the support is out there and it's sort of, if you build it, they will come. And that's not only workers, but donors and supporters too. So I don't know for what that's worth.
Thank you for that, Kate, and thank you for the support. It's truly a partner effort, so we really appreciate it. Thanks.
So fortunately, we're going to be back here after lunch and we can continue discussion. I'm imagining everybody's hungry. Lunch is out. Well, let's take a break, 30 minutes, and everybody go out and enjoy lunch, and we'll see you back in a half hour.